Okay, so welcome to the deep dive. Today we're diving into, well, it's kind of a personal topic, but a really important one. Urinary health in women.
Absolutely, a critical area.
And we've got some fascinating insights actually from the Be Aware Empowering Women's Health, specifically their blog post, Bladder Matters, how to maintain a healthy urinary system.
I've seen that, yeah.
So this is going to be your go-to guide for why this stuff even matters and what you can actually do about it. Sound good?
Sounds like a plan. Let's dive in.
All right, so first off, how often do we actually talk about urinary health?
Right. It's not exactly dinner party conversation.
No, it's not. But the thing is, so many women deal with this stuff. And it's not just like, oh, I had a UTI once.
Yeah.
We're talking things like incontinence, which can be, any kind of leaking, not just when you sneeze.
Right.
And then there's interstitial cystitis. Now, have you heard of that one?
I have, and it's often misunderstood, unfortunately.
So tell me more about that. What is it exactly?
Basically, it's chronic bladder pain and frequent urination, but it's not from an infection.
Oh, that's interesting. So it's kind of like a whole other beast.
Exactly. And it's important to differentiate it from, say, a UTI, which we're more familiar with.
Okay, so we've got these different conditions. But the key takeaway here is that they're not just minor inconveniences, are they?
Not at all. I mean, they can seriously impact your day-to-day life, your activities, your confidence, everything.
Wow, okay. So before we even get into solutions, let's talk about recognizing the problem. What are some of the signs that maybe something's off with our urinary health?
Well, Be Aware does a fantastic job of laying out those red flags. So one of the most obvious ones, and this is probably what most people think of, is having to pee all the time.
Right, like way more than usual.
Exactly. Or you suddenly get this really strong urge to go and you can barely hold it.
Okay, so frequency and urgency. Got it. What else?
Another big one is that burning sensation when you pee.
Yeah, no one likes that.
And then, of course, if you see blood in your urine, that's a straight-up call your doctor situation. No question.
Makes sense. Blood is never a good sign, usually.
Exactly. Now, those are the kind of classic urinary symptoms. But the Be Aware post also talks about some other things that you might not immediately connect to bladder issues.
Interesting. Like what?
Well, persistent pain in your pelvis or feeling pressure down there.
Huh. I wouldn't have thought of that.
Yeah, it's not always obvious. And then, of course, there's the incontinence we mentioned. Any leaking, whether it's a little or a lot, is worth getting checked out.
So basically, if something feels off down there, don't just brush it off.
Exactly. You don't have to just live with it. There are things you can do.
Okay, so that's a perfect segue. What can we do? The Be Aware blog has some great tips for lifestyle changes that can actually make a difference.
Absolutely. And it starts with something so simple but crucial. Staying hydrated.
Okay, drinking enough water. We hear that all the time. But how does it help with urinary health specifically?
Well, think of it this way. When you're drinking enough water, you're essentially flushing out your urinary tract.
Okay.
Getting rid of bacteria and anything that could irritate it. And that can really help prevent those UTIs.
So it's like cleaning out the pipes, keeping things flowing.
Exactly. Now, another easy one, but often overlooked. Good hygiene.
All right, basic hygiene. What do we need to remember here?
It's all about the direction you wipe after using the toilet.
Ah, right, front to back.
Exactly. You want to prevent bacteria from the back end from getting anywhere near your urethra.
Makes sense. It's a small habit, but could save you a lot of discomfort.
Absolutely. Now, this next one might be a little tougher for some people to hear.
I don't know. What is it?
Well, certain things in our diet, things we love, can actually irritate the bladder.
Oh, like what?
Caffeine, alcohol, spicy foods.
No, some of my favorites.
I know, right? But it's not a hard and fast rule. It affects people differently. But it's good to be mindful. Notice if you have more urgency after that extra cup of coffee or that spicy curry.
Yeah, pay attention to those patterns. Good advice. Okay, what about Kegels? We hear about those all the time, but how do they actually help with urinary health?
So Kegels are all about strengthening those pelvic floor muscles, which, support the whole area down there.
Right.
And strong pelvic floor muscles mean better bladder control.
So it's like a workout for your bladder.
Kind of. And it can be really helpful for preventing or managing stress incontinence, that leaking when you cough or laugh.
So no more awkward moments.
Exactly. And the great thing about Kegels is you can do them anywhere, anytime. No one even knows.
Totally discreet. I like it. All right, what else?
Well, the Be Aware folks also emphasize regular checkups with your doctor.
Okay, that's good general advice, but how does that specifically relate to urinary health?
Well, sometimes issues can be caught early, even before you have symptoms. And early detection is key. It means you can manage things more effectively, maybe avoid more invasive treatments down the road.
Makes sense. Catch it before it becomes a bigger problem.
Right. It's about being proactive, taking control of your health.
I love that. So we've talked about lifestyle changes, but what if that's not enough? What are some of the medical solutions that are available?
Well, thankfully, there are a lot of options these days. For those pesky UTIs, antibiotics are usually very effective.
Yeah, those are usually the go-to, right?
Mm-hmm. And for things like overactive bladder, where you're constantly running to the bathroom, there are medications that can help calm things down. They're called bladder relaxants.
Okay. So there's medication, but the Be Aware blog also mentions other approaches, right?
Yes, they do. Things like pelvic floor physical therapy.
Oh, interesting. So it's like physical therapy, but for your pelvic floor.
Exactly. A therapist can teach you specific exercises and techniques to strengthen those muscles we were talking about.
Okay. So it's good to know there are options depending on how severe the problem is. What about alternative therapies?
So lifestyle and diet changes are part of a holistic approach, of course. And some people look into herbal remedies or other complementary therapies.
But what's the most important thing for our listeners to remember if they're considering those alternative routes?
Talk to your doctor first, always.
Okay, good advice.
You want to make sure anything you try is safe, that it won't interact badly with other medications, and that it's actually right for your specific situation. Your doctor can help you figure all that out.
So it's about working with your doctor, not just trying things on your own.
Absolutely. Now, we've been focusing on the physical side of things, but the Be Aware post also brings up something really important: the emotional and mental impact of urinary health issues.
Yeah, that's something we don't always talk about.
Right. These conditions can be really tough emotionally. They can affect your self-confidence, make you anxious or even depressed. It can be hard to socialize or do the things you enjoy when you're worried about leaking or constantly uncomfortable.
Makes total sense. It's such a personal thing. It's bound to affect how you feel about yourself and your life.
Absolutely. So, along with treating the physical symptoms, it's crucial to seek support for your emotional well-being, too.
What does that look like?
It might be therapy, joining a support group, or even just having honest conversations with your doctor about how you're feeling.
It's all connected, right? Mind and body.
Exactly. You can't really separate them.
Okay, so as we wrap up, what are the biggest takeaways you want our listeners to remember from this deep dive into urinary health?
First off, remember, you're not alone. Urinary issues are common, especially for women. Don't be afraid to talk about it. And be aware in the symptoms. If something feels off, get it checked out. Don't suffer in silence.
Okay, good advice.
And then think about those lifestyle changes we talked about. Staying hydrated, practicing good hygiene, those Kegels, they can really make a difference. And know that there are medical treatments available. Don't be afraid to seek help if you need it.
So it's about being informed, taking action, and advocating for yourself.
Exactly. And one more thing. Remember the emotional side of things. It's okay to seek support for your mental health, too. It's all part of taking care of yourself.
That's so important. All right, well, the Be Aware blog ends with a call to action. Take action today. And I think that's a perfect way to sum this up. If anything we've talked about resonates with you, do something about it. Make that appointment. Try those Kegels, whatever it is. You have the power to make a change.
Absolutely. It's about prioritizing your health, your well-being, your quality of life.
I love that. And here's a final thought for you to chew on. Sometimes taking care of one thing can lead to positive changes in all sorts of unexpected ways. Thanks for joining us for this deep dive. We'll see you next time.